So joining me now, Dr. Tarek Hussein, who is a pharmacist. Why COVID-19 is more worrisome for the senior?
I think for two main reasons. The first one is that as we age, our immune system weakens, and this makes us more vulnerable to infections of all types. And the second reason is that, I don't know if you know, but 76% of Canadians aged 65 or more are living with at least one more chronic condition. Mm-hmm. And we know by now that people who are having underlying medical conditions face higher risk of getting sick from COVID-19. So if you put these two reasons together, you will see why your seniors might be a little bit of a higher risk than the rest of the population.
What you can tell us, how our seniors can eliminate or have the less risk?
So I think everyone by now knows the answer to this question, but I love to repeat it again to you and our seniors here. There are two groups of activities that I recommend for everybody, particularly our seniors. The first group of activity is related to social distancing. So staying at home, avoid close contact with people by keeping at least 6 feet distance, avoid all non-essential travel. And the second group of activities is related to hygiene. Mm-hmm. So wash hands frequently with water and soap for at least 20 seconds, using alcohol-based hand sanitizers. If water and soap is not available, cough or sneeze in the crook of your arm, avoid touching your eyes, ears, nose, and mouth, and clean and disinfect frequently touched surfaces.
How can senior access their regular medication?
Well, Jimmy, you know that pharmacies are essential services and pharmacists are frontline healthcare providers. We are required by law to stay open. Mm-hmm. Here's what you need to do to access your community pharmacy in these days. Number one is if you are not feeling well, do not visit the pharmacy. Arrange for delivery or have someone else pick your medication. Mm-hmm. Number two, try calling or emailing the pharmacy before visiting for quick pickup of your prescription medications or have them delivered it to your home. Number three, if you do go to the pharmacy, avoid unnecessary touching of merchandise, counter, payment machines, or other store items. And number four, again, wash your hands or use hand sanitizers before going to the counter. In our pharmacy at Weller, we have hand sanitizers at the counters for use. And number five is to exercise social distancing by avoiding physical contact with the pharmacist and technicians and keep distance again of at least 6 feet from the staff and other visitors.
Mm-hmm. How many days supply of regular medication should a senior have it?
So the Ministry of Health is recommending pharmacists dispense not more than 30 days of supply of Ontario Drug Benefit eligible medications. The reason for that is to ensure continuous drug supply to cover our patients for as long as possible. But as always, we continue to use our knowledge, skills, and professional judgment on a case-by-case basis to act in the best interest of our patients and the community in general.
What if a senior needs a new prescription or runs out of the refill? What do they have to do?
Well, I recommend calling your pharmacist first. Pharmacists might be able to extend your prescriptions for up to 6 months for chronic medications or chronic conditions. Pharmacists as well can communicate with your doctor for requesting refills, early releases, and treatment changes on a case-by-case basis. 2 days ago, the Health Canada gave pharmacists temporary authority to refill, extend, and accept verbal orders on narcotics and controlled substances. Mm-hmm. It's exceptional, and it clearly reflects the value and trust in what community pharmacists can do.
What is the risk, or is any risk there the senior will not get their medications?
If everyone does their role, Jimmy, I see very low risk of senior not getting their medications. We are working very hard in collaboration with our suppliers to make sure we have enough for all our clients.
That's very good to know. When we talk about the personal hygiene, washing your hands, keep clean yourself, keep the social distance, how critical is to when you go out for any reason, having a mask or gloves on?
That's a very good question, Jimmy. There is a lot of information about that on the social media, a lot of discussions. Both might be beneficial. My take on the gloves is, once you touch anything with the glove, you have to remove the glove. So as long as you are sure that you are not touching your face after touching anything with the gloves, you're good. The recommendation is every half an hour to maximum an hour, change the glove.
So it's the same thing you're applying on when you wash your hands. If even you have a gloves on, you have to either change it when you touch something, or you continue to wash. Can people wash their hands while they have a gloves on? Can they wash off the gloves as well?
We can do, but the studies that are coming like recently showing that the virus can stay on latex, for example, which is the material that most gloves in the market have for a long time. So definitely washing the gloves will make sense, but we also recommend removing it completely and changing it regularly. So when you look at the outcome, I think that the general population, the public, should, unless you are really touching something you really are worried about, just washing the hand with hands and with soap and water is enough. Also using hand sanitizer is enough. When it comes to masks, which is an important part, the masks in the market, or the regular masks that does not cover protect the public from the virus. Okay, and we have a lot of shortages for the ones that are used for protection, which is the N95 masks in our hospitals. So what we recommend is hospitals should get the masks, and you use the mask only if you are sick, to protect the others from the droplets coming out of you.
I want to ask you, as a pharmacist, as an expert, how effective is if somebody make their own mask at home with some kind of cotton clothes, and they use it, and so is a washable as well?
Well, it's an excellent question, Jimmy, and I just read an article that came yesterday in the British Medical Journal that they compared actually masks that are made of cloth and sewed at home versus the masks that we use in the medical practice, and it showed that these masks can actually cause more risk for getting more infected because of the humidity that happens when you use a cloth on the mouth. It creates a humid environment, and this can actually make the virus, you make the person more prone to get the virus than the standard masks we have, which actually can filter 95% of the bacteria. Okay.
Mm-hmm. So you're suggesting that people do not use the homemade mask with the cloth, or because there's a lot of videos on, then you can use a tissue paper and put those rubber bands around and put it on. So a lot of people is trying, but my question is seriously to ask you, we have to have a mask, or it doesn't matter when you go, if you're not sick, then you don't have to a mask?
In general, if you are not sick, you don't need to use a mask.
Mm-hmm.
The mask is used only when the person is sick.
Yeah, okay.
The droplets from getting out to the people around them.
Okay, I'm going to ask you another very important question, Hassan. How can the pharmacist help in protecting the senior?
There is a lot of information in social media about the COVID-19, and there is a lot of myth, as we were just talking about the masks and other things, that has been circulated. When it comes to COVID-19, your pharmacist is the most credible source of information about the use of medications, over-the-counter products, and herbal products. It is a serious condition, but with accurate information from your healthcare providers, including pharmacists, you can dramatically reduce your risk.
That's very good. Well, thank you very much, Dr. Tarek. I think I got a lot of good information from you. The last question before we go, what is the best suggestion you want to give it to the people? We hear all about the social distance, hygiene, and all the other stuff, but the best thing we can do to protect ourselves and protect our loved ones?
Stay home.
Do you see that happening?
I actually, I can upload a lot of Kingstonians for doing that, but we need to do more. Stay home to protect yourself and protect others.
Well, thank you very much. It was nice talking to you, and hopefully in the future we'll talk again.
Thank you so much for having me.
Thank you. Bye-bye.